In this sketch, we're going to talk about labor, that final hurdle before the main event. And so for that, we head into space. Before these astronauts can return to Earth, they gotta make sure all these space pods are delivered. But it seems like there are a few alarms going off. Let's try to help them out, shall we? But first, we gotta know what we're dealing with. So what is labor exactly? Labor is defined as uterine contractions that cause cervical change, either in dilation or effacement. This space station is reminding us of these two important components with its giant prepare for dilation and effacement sign above the closed aperture. If it's true labor, as opposed to false labor, which we'll go over in a sec, the contractions usually get stronger and closer together as time progresses, just like this pressure reading. False labor, on the other hand, also known as Braxton-Hicks contractions, are uterine contractions that do not cause any cervical change. These contractions are usually shorter in duration and irregular, as in they don't come at regular intervals. This is a tricky one to tease out, but you can remember it with Captain Hicks's irregular-looking message that's reminding us not to accept any false packages. Okay, so if labor depends so much on the cervix changing, what is considered cervical change exactly? Like we briefly touched on, cervical change is either dilation or effacement. Cervical dilation is when the cervical os opens to allow passage of the fetus's head. 10 centimeters dilated is considered full dilation. You can see that this pipe and aperture over here on the left form a 10 when put together. Pretty neat, huh? Cervical effacement refers to how thinned out the cervix is, which is why we've represented it with the space soldier's thin cape. 0% effaced means that it's at maximum thickness, and 100% effaced means that it's completely thinned out, almost to the thinness of saran wrap. When a cervix is 10 centimeters dilated and 100% effaced, your patient is ready to push! Before we dive into how to describe the stages of labor, you should know how to describe the fetus, as certain positions can influence whether or not labor can be abnormal or whether a vaginal delivery is contraindicated. The descriptions you should know are fetal lie, presentation, position, and station. Fetal lie refers to the position of the fetus's spine in relation to the mother's spine. The possible fetal lies are longitudinal, which is when their spines are parallel, transverse, which is when their spines are perpendicular, and oblique, which is everything in between. We'll represent fetal lie with the space station pod whose blue spine is being measured in relation to these red lines crisscrossing over it. This should help remind you that fetal lie is the relationship of two spines. Fetal presentation refers to the presenting part, or which part is closest to the internal os. It's the part that presents at the vaginal introitus first during delivery. The two most common presentations are cephalic and breech. A cephalic presentation means that the fetus is head down. Breech means that either the feet or the butt is the presenting part. Cephalic presentation can be further subdivided into which part exactly is presenting. If the crown of the head is presenting, this is called vertex presentation. Much rarer are brow, face, and chin presentations. We'll remind you of fetal presentation with the space pod whose head is diving into the circle underneath it. For this space pod, its head is the presenting part. Fetal position refers to the position of the fetal head in relation to the maternal pelvis. Specifically, it describes where the fetal occiput is in relation to the maternal pelvis. So, for example, if the fetus is occiput anterior, it's facing down or towards the posterior side of mom's body. If it's occiput posterior, this is sometimes referred to as sunny side up, because if the baby is delivered in this position, it comes out face up. This third space pod is spiraling around, trying to align its occiput in the right place within this circle. Lastly, fetal station is the location of the fetus's head at the level of the biparietal diameter in relation to the maternal ischial spines. 0 is when the biparietal diameter is at the level of the ischial spines. If the head is above the ischial spines, further up the birth canal, you can count the centimeters and add a minus sign behind it. So, for example, if the head is 2 centimeters above the ischial spines, you'd refer to the fetal station as -2. Any location in front of the ischial spines is a positive value. So if the head is 1 centimeter in front of the spines, the value is at +1. +3 to +4 means you can see the baby's head at the introitus. But hold on, let's back up a little. We're not quite ready to deliver the baby yet. There's still a lot more to learn about labor itself. Labor is divided into 4 stages. Stage 1 of labor spans from the time of the onset of labor until the patient is fully dilated to 10 centimeters. The first stage of labor is further divided into the latent phase and the active phase. The latent phase of the first stage of labor is the time from when the patient is 0 centimeters dilated to when she's 6 centimeters dilated. It's called the latent stage because cervical dilation tends to progress more slowly during this time. Everything to do with the latent stage is going to be symbolized over here by this hologram of a space pod that's floating above a partially opened aperture, to remind you that delivery is still a ways away and the cervix isn't fully dilated. The active phase of the first stage of labor is from 6 centimeters dilated to 10 centimeters dilated. Cervical change in dilation occurs more rapidly during this time. The active phase is represented by this other space pod hologram that's floating above a fully opened aperture. Stage 2 of labor encompasses the time from full dilation until the baby is completely delivered, which is why this third space pod hologram has been delivered through the fully opened aperture. Yay! Everything to do with the second stage of labor is going to be symbolized over here on this second console. Stage 3 of labor is the time from delivery of the baby until the delivery of the placenta. It's represented over here at console 3 by this disc-shaped UFO flying off into the distance. And finally, stage 4 of labor is the 2 hours after the delivery of the placenta. We've put a 2-hour timer next to the disc-shaped UFO to remind you of this time cutoff. Now that we've reviewed some key definitions, let's go over what's considered abnormal labor and why we care about it. All of the complications of prolonged labor are going to surround this alarm that's going off. They include infection, especially chorioamnionitis, which can lead to sepsis in the mom and baby, symbolized by our recurring bacteria lanterns, postpartum hemorrhage, symbolized by this red liquid leaking from the ceiling, and finally, if the fetus doesn't make it out vaginally, it still has to come out somehow, so abnormal labor can lead to surgical intervention, as in a C-section. We'll remind you of this with the scalpel stuck in the ceiling. Now we're going to go through each stage of labor and the respective disorders that can occur during each one. Starting with the first stage of labor, which remember is divided into latent and active stages. An abnormal latent phase of labor is greater than 20 hours in nulliparous women, which means women who have never delivered a child before, and greater than 14 hours in multiparous women, as in any woman who has delivered 1 or more children. We've registered a docking time error underneath the latent hologram on console 1. The times here should remind you of the cutoff for an abnormal latent stage. Disorders of the active phase of labor are either due to prolonged labor or arrest of labor. A prolonged active phase of labor means that dilation is happening slower than normal based off of population data. This is defined as dilation less than 1.2 centimeters per hour in nulliparous women and less than 1.5 centimeters per hour in multiparous women, and is symbolized as this portal dilation error underneath the active spacepod hologram. Arrest of dilation is another type of abnormality of the active phase of labor. The definition of arrest of dilation is ruptured membranes plus either no cervical change over 4 hours with adequate contractions, which means contractions equaling at least 200 Montevideo units over 10 minutes, or no cervical change over 6 hours without adequate contractions. We've symbolized arrest of dilation with the warning message, "Warning, arrest of dilation," on console 1, since technically we're still in the first stage of labor. As you can see by the 3 screens on console 1, there are 3 possible abnormalities during the first stage: a prolonged latent phase, a prolonged active phase, and arrest of dilation. So what do you do if you have one of these disorders? Well, that's a pretty advanced topic, and though the subject of labor management is one that's too large to cover here, the first consideration you should have if a woman is having an abnormal first stage of labor is to augment her contractions with Pitocin, the synthetic form of oxytocin. This should increase the frequency and strength of her contractions. You can also consider an amniotomy, or artificial rupture of membranes, which is when you break her bag of water. In fact, ruptured membranes is a requirement to declare arrest of dilation, as we just reviewed. We'll remind you of these interventions with this astronaut at console 1 rupturing the glass over the emergency button, and hey, he's got an ox on his back to remind you of oxytocin too. If the patient's labor truly arrests and she's stopped making any cervical change, it may be necessary to deliver the fetus via C-section, symbolized by the scalpel jammed into console 1. Okay, so if your patient makes it past the first stage and she's 10 centimeters dilated, is she in the clear yet? Not quite. There are also abnormalities of the second stage. A disorder of the second stage of labor is called arrest of descent, which is when the fetus doesn't make progression down the birth canal. This is technically defined as greater than 3 hours of pushing with no descent of the fetus in nulliparous women, 4 hours if she's had an epidural, or greater than 2 hours of pushing in a multiparous woman, or 3 hours if she's had an epidural. All of these numbers are here underneath the warning arrest of descent reading on console 2, which will also remind you that arrest of descent is part of the second stage of labor. Arrest of descent is usually due to cephalopelvic disproportion, which refers to when the fetus is too large to fit through the maternal pelvis. This can be due to fetal malpresentation, which means that a diameter larger than the smallest possible diameter is trying to move through the birth canal. Maternal exhaustion and poor pushing power can also be a cause of arrest of descent. If a patient has an arrest of descent, you have two options: either an operative vaginal delivery or a C-section. An operative vaginal delivery is done if the fetus has a fetal station of at least +2 and involves either use of a vacuum or forceps. These tools are used to help pull out the fetus if the mother's pushing has become ineffective. If the fetus is still high up, a C-section must be done in order to deliver. Finally, let's go over the normal movements of labor and delivery. These are called the cardinal movements of labor, and there are 7 of them. Engagement, which is when the fetal head enters the maternal pelvis. Descent, which is the fetus moving down the birth canal. Flexion, which is when the fetal head flexes, which means the chin moves closer to the chest so that the smallest diameter of the head is occupying the birth canal. Internal rotation, which means the fetus rotates, usually into the occiput anterior position. Extension, when the fetal head extends. External rotation, so that the shoulders come through. And finally, expulsion, which is when the entire fetal body delivers. And just like that, we did it. We delivered a space pod. I mean, baby.